We'll be starting in just a couple of minutes as people come in. Hi, everyone. Welcome to the webinar presented by the National Collaborating Center for Healthy Public Policy, Wellbeing, Budgeting, and Public Health, Promising Practice for Pandemic Recovery. My name is Val Morrison, and I'm a scientific advisor at the National Collaborating Center for Healthy Public Policy, or NCCHPP. And I'm joined today by my colleagues, Hélène Poliquin and Mylène Maguire. Mylène has looked after all of the logistical and technical requirements for the webinar today, and she'll be here throughout to help with any problems that anyone might have. Hélène, who also works with us on the Wellbeing project, will help with hosting duties, and she's ready to take over in case I should have any connectivity problems or issues. So thanks to my colleagues, Hélène and Mylène, for helping to bring this together. We also have two guest speakers joining us today who I will introduce in just a few minutes. So just a couple of technical notes so that everyone is aware of how this will work. All of the mics for participants are muted, and because we have over 200 people registered for the webinar, it won't be possible to ask live questions. But we do have two ways that folks will be able to participate, and that is through the chat function. So we'd ask that you use the chat on the bottom of your screen to exchange with each other, share any information or resources that you'd like to share with participants. We also have the possibility of the Q&A function, also on the bottom of your screen. We ask that you use this to ask questions of our guest speakers. That's for one thing. And the other thing is you can also use the Q&A if you have any technical issues. Mylène will be monitoring that for technical issues. Hélène will be monitoring it for questions for the participants. There's also a possibility in the Q&A function to vote for a question that someone else has asked by clicking on the thumbs up symbol. So if you see a question there that's similar to yours or one that you want to hear the answer to as well, click on that. I should also just remind you that we are recording the webinar, and that includes the chat box and the Q&A box. So keep that in mind if you are going to be using those functions. I'll just tell you a couple of words about the National Collaborating Center for Healthy Public Policy. Our mandate is to support public health actors in their work to develop and promote healthy public policies. And you see on your screen a list of some of the projects that we're currently working on. The Collaborating Center is one of 6 national collaborating centers for public health that are situated in various host organizations across the country, and they're financed by the Public Health Agency of Canada. Our center is hosted by the Institut National de Santé Publique du Québec, or Quebec's Public Health Institute. And our offices are located in Montreal, and we'd like to acknowledge that in Montreal, we are on an age-old Indigenous territory, a place of meeting and diplomacy between peoples, and the site of the signing of the Great Peace Treaty. We want to thank the Kanien'kehá:ka Nation for their hospitality on this unceded territory. So by way of getting us started today, what you see on the screen here is a series of titles, organizational logos, headlines about well-being and well-being budgets. Although the will to measure well-being and address well-being is not a new one. For example, the Canadian Index of Well-being has existed since 2008. But what is more recent are initiatives to integrate well-being into policy and into budgeting. And in the last couple of years, we have seen countries such as New Zealand, Wales, Iceland, Finland, and Scotland, among others, adopt various forms of well-being budgets. And at various levels, this idea has also been percolating in Canada, and we've seen an increase of interest in and discussions about how we might integrate well-being into policy here as well. And over the past several months, many have wondered if now is the time, as we consider the best ways or promising ways to address the recovery from the COVID-19 pandemic, to put well-being at the heart of that recovery. Indeed, in the mandate letter sent to the Minister for Middle Class Prosperity and Associate Minister of Finance in late 2019, Prime Minister Justin Trudeau put quality of life measures on the policy agenda in Canada. Of course, this was just before the beginning of the pandemic, and we will now have to wait to see if indeed lessons will be drawn from the well-being budgets of New Zealand and Scotland. When the finance minister delivers the fall economic statement next week, we'll see. But what we can certainly say is that Canada seems to be on what we might call the well-being budgeting path. So with that in mind, before we get into today's material, here's how you, as registered participants, rated your knowledge of well-being budgets. So you can see here that the vast majority of people rate their knowledge of well-being budgets as low. And this is a good thing, because what we really want to do today is answer three main questions through the presentations and the question and answer period. So the main questions that we want to answer are, what do we mean by well-being and well-being budgets? How is well-being related to public health practice? And is well-being a promising one in the wake of the COVID-19 pandemic? So the format we'll follow is each of our guest speakers will present for a short period, and then we'll have an exchange with questions that we've already discussed. And then we'll have questions from you as participants. So without further ado, I will introduce both speakers now so that we don't have to spend too much time changing who has control of the screen. So I'll introduce them both now, and then they will speak one following the other. So our first speaker will be Chris Barrington-Lee. Dr. Barrington-Lee is Associate Professor at McGill University, jointly appointed at the Institute for Health and Social Policy and the Beeler School of Environment. His recent research is focused on empirical and quantitative assessments of human well-being measured through subjective reports and their implications for policy. Dr. Barrington-Lee was originally trained in upper atmospheric and space plasma physics at MIT, Stanford, and Berkeley before studying economics at the University of British Columbia. Chris was a global scholar of the Canadian Institute for Advanced Research and is a current member of the Global Young Academy. Our second speaker will be Lindsay McLaren. Dr. McLaren is a professor in the Department of Community Health Sciences and in the O'Brien Institute for Public Health at the University of Calgary, where her research and teaching focus on healthy public policy and the social determinants of health. She is also a research associate at the Canadian Centre for Policy Alternatives, where she is currently spending a one-year sabbatical. Dr. McLaren held a CIHR, PHAC, AIHS Applied Public Health Chair from 2014 to 2019, and in 2019 received the CIHR IPPH, or Institute for Population and Public Health, Mid-Career Trailblazer Award that recognizes exceptional contributions in population and public health research. Lindsay currently serves as the senior editor of the Canadian Journal of Public Health and as co-editor for the international journal Critical Public Health. So I thank both of our speakers for agreeing to be with us today. And with that, I will turn control over to Dr. Barrington-Lee. Chris?
Let me try that again. Did I unmute now? Yes. Okay. Thank you for the intro. Thank you very much for holding a webinar on this topic and for inviting me. So I think my task is to try to define well-being budgeting. I'm going to give you a very concrete version of that, which I hope is constructive. Let me start by giving you this conceptual picture, just to convey the idea that policy affects a variety of domains in our lives and, say, in the fabric of society. But those outcomes are ultimately intended to make lives better for people. And a value of well-being budgeting is that it gives us an overall framework for pursuing these goals synergistically, and it avoids having any one of these goals become an end unto itself. And it transcends getting stuck in thinking that any one of these goals here is the outcome by which all the others should be judged, for instance, income or health. Having a measure of overall well-being can help us make trade-offs and decisions within each of these domains, and then also among them. Ultimately, having some kind of overall, overall well-being goal or framework is intended to make sure that there's a human-centered guide to policy. And that means that policies are ultimately accountable to human experience. So I'm going to use one very specific way to operationalize an accounting of well-being, and that's this life satisfaction. More on that in a moment. Let me first talk about the budgeting part. So what is budgeting? So I would say budgeting means that we have a framework for making hard decisions. So if we are down to our last $1 million of budget, we have a framework. It means we want to have a framework for thinking about whether those resources should go towards, say, hiring extra social workers or buying extra social housing or something else. So that means that our measure of well-being that guides those decisions needs to be something reproducible, I would say empirical, and as I mentioned earlier, human-centered. And I won't belabor this point here, but I would argue that ultimately, if it's going to capture human experience, it's going to need to be subjectively based. Okay, so that brings me then to what we mean by well-being. And I think it's really important to start by recognizing that without a measurable definition of well-being, this word means whatever you want. So without a measurable definition, it's really, and I would say typically, or often anyway, it's branding, it's rhetoric for someone's pre-existing agenda for whatever they were going to do anyway. So the word by itself, maybe is not very useful, and depending on who's using it, it could mean anything from an absence of diagnosable disease to GDP per capita to even lower greenhouse gas concentrations in the atmosphere. So please, and so let me, it's not alone. In fact, there's a bunch of words. So there's well-being now without a hyphen. There is these other terms like social welfare, maybe my least favorite, wellness, quality of life, progress, happiness. These all have the same very diverse set of possible meanings. So as a starting point, when you hear this, please bring your skepticism. And I think it's very important for well-being budgeting to have something concrete enough. So I'm going to give you an exceedingly precise definition. And one good measure for overall big picture, maybe criterion for well-being, for something to really be a well-being budgeting framework, is that it actually has to change what happens. It's got to change decisions. It has to influence what gets allocated, as opposed to redressing things that are actually being made by let's say by some other criterion or some other framework. So there is a large and growing body of researchers and practitioners that are appealing to this life satisfaction measure as a guide to how good life feels to people. And what that means is literally the answer to a single survey question that goes as follows: taking all things into account, how satisfied are you with your life these days on a scale of 0 to 10? So the answer here is actually quantitative. It's a number between 0 and 10, even though this is about as subjective a question as you could dream up. So just just to reiterate, I mean, this, life satisfaction approach is only one detailed framework for operationalizing the measurement of human well-being, but this has brought robust and quantitative evidence and insights about what it is that makes for good lives for individuals, for communities, for societies, for countries. And in particular, a finding or theme in the findings that I will emphasize is that we have learned a lot about the role of individual and collective social relationships at all income levels as really important factors in sustaining good lives. Okay, and as I mentioned, I think it's really useful to have an explicit operational definition in talking about well-being budgeting. In fact, for well-being budgeting, it's probably essential to have something that you can actually define carefully. And I'm not going to go into the details. We have 4 decades now of experience understanding the answer to this question. But I won't go into too much more detail about it now. I'll ask you to accept that we know a lot about how people answer that question. And it asks them, of course, to take everything possible into account. So in some countries like Canada, we know what the answer to this question looks like in high resolution and over time. So here I'll zoom in on Montreal as an example. So this is just people's raw averages for the people's answers to this life satisfaction question. So clearly this provides a single quantitative measure of well-being. And rather than worrying that we might have missed something in this approach to well-being, instead we have something that is all-encompassing in a sense we leave it entirely up to the respondent to take into account whatever it is that affects them and their experience. So instead we have the opposite problem, or another problem, which is how do we disaggregate this measure to know what is causing people's experience to differ and what we might be able to change to make lives better. And so that's where statistics comes in. Typically, when this question is asked, we're also asking many other questions that come on, for instance, StatCan surveys where we know a lot about each individual, also about the groups they belong to or location they live, and we might have other variables that we know based on those things. And so then it's up to the statistics to tell us the multivariate relationships between, say, loneliness and life satisfaction, or access to green space and life satisfaction, or access to transit and life satisfaction, or a particular chronic disease and life satisfaction, and so on. And of course, ideally, we're after making causal inferences about how all of those things and others affect life satisfaction at once. We also know what this measure of well-being looks like across 150 countries, and over time now for over 15 years in the largest data set. And that looks like this around the world. So what have we learned about well-being from such global data? I mean, the first thing to see here is that there's enormous variation globally in how people respond to this question, from countries where the average answer is 3 to those where it's nearly 8. And we can explain not just differences across countries, but also differences over time. And I'll move a little bit quickly here. Here are some examples of countries that have changed quite drastically over time. It turns out we can analyze and explain these trends, and we can account for most of the variation across countries and also changes over time with just 6 variables at the country level. You're going to have to look at the look at the paper for a full explanation of this, but I want to show you a study we did to think about what life could look like in 2050 in 2 different sets of scenarios. And the first one is where the only thing that changes in any country is income and healthy life expectancy. And that's this top 2 rows. And the takeaway here is that actually life could get a little bit better, but not all that much, and probably not too much and not much worse. In the other pair of scenarios, neither income nor healthy life expectancy changes at all. But what instead changes are 4 other variables that relate to trust and friendships and freedom and opportunities to help others. And if those variables change in feasible amounts, life could get radically better almost everywhere. Or indeed, if we mess those things up, much, much worse everywhere. So how is that possible? It tells us that we really need to re-examine how we think about the allocation of resources and priority setting, I would say. And it's very interesting that we see very consistent patterns around the world in what causes life to feel good. So the scenarios I showed you are possible because even in developing and transition countries, much of the low-hanging fruit for improving lives is not obviously tied to income. It's tied to these social factors that seem even to mediate the benefit that we get from a lot of material supports. In fact, one of the sadder stories currently, which is almost single-handedly responsible for the global average life satisfaction to be decreasing right now. Most countries, it's going up. India, from between 2006 and 2018, has doubled in GDP per capita, but life satisfaction has taken a really, has decreased a lot and is continuing to do so. Okay, so to drive this home in kind of a qualitative language, one of the things that we have learned very robustly from many, many studies in this field is that it turns out humans are very social beings. And it's a lot of our well-being is driven by the fact that it's important to feel like we belong to groups, that we are able to contribute, that we are needed, that we are able to trust people around us and institutions, that we are engaged in meaningful activities with others, that we can contribute. And so I'd like to summarize these things with these 4 words. If you show me a society where there are strong supports for dignity, for inclusion, for people to be connected, for efficacy, you will have a happy society. And as I've hopefully made clear, I'm showing you pictures and words, but these are all, this field is about numbers. So measuring life satisfaction directly allows us to be quantitative, including about where and when, what things we're uncertain on. I will just give you a couple quick examples of insights from life satisfaction. One of the important things is it doesn't give privilege to avoiding, say, diagnosable or discrete problems. So it gives as much weight to improving life as it does to avoiding, bad lives, let's say. It also, I just want to give one quantitative, one example of what an approach like this does for thinking about inequality. If you compare it with GDP or income as kind of an implicit goal or measure of well-being, transferring $1,000 from somebody who's wealthy to somebody who's poor makes no difference in average income. Whereas it absolutely does increase average life satisfaction. And that's because, not surprisingly, the marginal benefit to life satisfaction of $1,000 for someone who's poor is much higher than for someone who's wealthy. And so, and this is something perfectly quantifiable. And moreover, those quantifiable numbers are very nicely relatable, easily relatable to, or directly linked to, this easy to relate to idea of life satisfaction. I won't talk about the rest of these. I mean, unemployment we found is probably about twice as important for life satisfaction as you would guess based on the income loss. And that's because unemployment relates to a loss of our identity and social relationships and ability to contribute and so on. So it has a huge toll on life satisfaction, which is certainly relevant to our current plight. I just want to end by pointing out that, as I said, life satisfaction is just one way of operationalizing a well-being budgeting approach, but it seems to have everything we want, and it's got enormous momentum. So this is the OECD guide to measuring subjective well-being. Life satisfaction is the #1 recommended measure for well-being, true of the US National Academies of Science. There's a huge amount of attention to subjective life evaluations through, for instance, the World Happiness Report every year. This is from the 2017 World Government Summit, where people are thinking seriously now about well-being and policy, which is why we're here. There's a global policy report which looks at best practices based on the life satisfaction approach, essentially more or less explicitly in a number of domains. And I won't be able to go over those, but I'm flashing them up anyway to maybe inspire you to go and look at the report. I find these very inspiring. There are changes which, both in health and education and other domains, which I really think could be revolutionary, just following the evidence. And I wanted to mention that there have been several attempts recently within the last year to formalize an all-encompassing budgeting approach by defining something akin to quality-adjusted life years or disability-adjusted life years, but doesn't have the problems of those. And ultimately, the decision-making resource allocation policy question is really about return on investment ultimately. And so this is a human-centered return on investment measure. And here's another similar example. This one was called WALL-E. These people called theirs Wellbeing, but it's the same thing. And they used it to ask when would be a good time to release the lockdown in the UK. And so, you can see all the very disparate domains of policy they're able to accommodate in this measure, in having sort of a common currency of quantifiable well-being. So if you release the lockdown, people get income back, they are relieved from unemployment, mental health improves, confidence in government, importantly, is likely to improve. People get to go back to school. On the other hand, they start commuting again. And so, you get more COVID-19 deaths from reducing the lockdown, most likely, but people start commuting again. And so you actually get more road deaths, more suffering from commuting, which is bad, CO2 emissions, air quality, and so on. And so these can all be taken into account in a integrated framework. And I'll probably maybe incorporate this idea here into a later discussion. I want to say, having gone over a little bit, one more thing, which is maybe why I'm most passionate about what a practical and implementable well-being budgeting framework offers. And that's to do with something I haven't really mentioned, which is long-run sustainability. I feel like there's a crisis in democracy and in evidential reasoning, and many people seem to be facing some sort of cognitive dissonance. And I think this is because people are afraid, and we don't have positive visions of the future. And when people are afraid, they think, they think short term, they think defensively, they become less creative, they are less outgoing, they're less pro-social, they build walls rather than reaching out and innovating. And rather fortuitously, what we've learned about human well-being from this approach tells us that there are many ways we can improve life that don't have an environmental footprint. So by appropriately putting attention to the social fabric, to supporting mental health, to building inclusiveness and so on, we have a big scope for improving lives that doesn't require material consumption. Now, that's not particularly good for the environment. It's got nothing to do with the environment. What it means is that we have policy space to offer people a credible story of life getting better in the future at the same time as we impose new material constraints. And so this is really the only credible and feasible way that I know to actually be able to lay out a policy path forward in which lives are, can improve at the same time as we meet our ecological mandates, say. And I've taken a bit longer than I promised. Here are some other places to look up more information. Thanks.
Great, thanks, Chris. And thanks very much for the opportunity to participate in this webinar on this very important topic. So following from Chris's segment, I will focus my comments on what I see as the connections with public health. And in particular, how does or could well-being budgeting align with a public health approach? And what might be some opportunities for public health communities? And I'll actually start with my main conclusions, which are that firstly, well-being budgeting, I think, potentially aligns very well with a public health approach. And secondly, that we would do well to find ways to constructively engage in this discussion. I think it makes sense to start with a definition of public health. I admit to spending more time than I care to disclose thinking about this. In case this feels overly basic or like navel gazing, I would argue that it's actually quite important because public health is not well understood. It's routinely conflated with publicly funded healthcare, which dilutes or minimizes some of our unique contributions. And even in the current COVID-19 pandemic, when public health has been in the spotlight, it's a very narrow version of public health that's been perpetuated. So a definition like this one, which happens to be from the Canadian Public Health Association, but it's similar to many others out there, it reminds us of some of the key features of our field, which I think are essential for engaging in the well-being budgeting discussion. So for example, through an emphasis on prevention, primary prevention and health promotion, it's at least theoretically consistent with a broad version of health that includes well-being. So health conceptualized as a resource for living as opposed to an end in itself. And it also prompts upstream thinking about determinants of health and well-being and their public policy antecedents, which of course include, but are not limited to, public budgets. The general idea of well-being budgeting, I think, is conveyed well in this statement from New Zealand's 2019 budget statement. So essentially, it's an approach to public budgeting that is based on the idea that gauging the long-term impact of policies on the quality of people's lives is better than focusing on short-term output measures. And this idea is based on two key observations. So firstly, it's based on the recognition that using economic growth as a marker of a society's success, which is what we currently do, comes with two very serious drawbacks. It leads to increases in inequality and it destroys the environment. And so already here are two things that we care deeply about in public health, or at least we say we do. Secondly, although there are different versions of this, advocates of well-being budgeting seem to be explicit, and I think we saw this with Chris's slides, explicit in the recognition that outcomes of policy transcend sectors or traditional thematic policy domains. So again, very consistent with thinking in the social determinants of health, intersectoral activity for health equity, health in all policies, et cetera. So I would emphasize, I guess, the significance of these 2 points, at least in my opinion. So amongst those working in this area who transcend quite different disciplines and sectors, there seems to be broad agreement on these 2 points, which I think is very significant. So I sort of have the sense that if we can agree on this, we can figure out the rest. So these are just a few examples of how these foundations of well-being that I had on the previous slide align with things that we care about in public health. And I'm sure those on the call will immediately recognize a number of these initiatives, and it's just a snapshot. There are many that are missing. Concern with health and social equity, the critical importance of ecological determinants of health, including climate change, and the imperative of public policy responses to be intersectoral. Some of these images you've already seen in Val's intro slides as well as in Chris's slides. So just to make the point that there is a lot of work going on around this topic. So several countries have tabled well-being budgets. Most of these are fairly recent. And there's considerable scholarly and intersectoral work on indicators and measurement that has been going on for years, or in some cases, decades. So there are some different perspectives and different emphases here. And there's a lot that we could discuss concerning conceptualization, measurement, implementation, et cetera. And I believe we'll probably get into some of that in the discussion. But just as a summary comment for now, I would just identify that there's an important critical thinking opportunity here. So for example, perhaps not surprising considering the potential breadth of the well-being concept, discussion about possible ways to improve it, it is equally broad. And amongst the different pieces of work and groups that are working on this, I have seen things like the beneficial effects of volunteering or other forms of giving, or of educational curriculum that aims to build resilience in students. And so there's certainly some merit to these ideas, but I would be concerned, or I would at least want to know more about how we would avoid ideas like these displacing or pushing out more upstream socio-structural solutions and approaches. And so I think this falls under the general problem of downstream drift, which is a phrase that I'm sure many on the call are know and love, so to speak. But taken to the extreme, it could take the form of, I would say, smoke and mirrors, where the beyond GDP language, so meaning beyond economic growth as a marker, beyond GDP language is used somewhat nefariously to justify very individualized solutions. So measurement of well-being, at the risk of stating the obvious, is not neutral. Power is embedded into that process like it is in everything else. And so it's important to emphasize that these potential concerns are not unique to well-being budgeting. They're challenges that we face all the time in public health. But I think they're worth noting here just because there's something that I believe we could bring to the table and discuss. One other item I would note, and this is from the Global Happiness and Wellbeing Policy Report, which is a very visible presence in this field. One thing I noticed right away is when this group talks about health, they're actually talking about healthcare. And so returning to some of my initial comments, I don't believe that that's an accurate or helpful way of thinking about health or public health. So again, this is something that I would want to just know more about. I'm not saying that there aren't discussions or answers to this, but I would just want to know more about this. So in closing, I think there are lots of ways that members of public health communities could constructively engage in well-being budgeting discussions. So these are just a few thoughts. One I would say is to actually get better at engaging in discussions about economics and economic policy. I've personally observed in some situations a lack of this in public health, where sometimes there's some disengagement from economics, whether it's feeling intimidated by the numbers and the quantitative nature of it, whether there's an assumption about an impenetrably different set of ideological assumptions, whatever. But I do think it would serve us well to be able to engage in that better. And of course, there are people who do this very well, talking more about us as a whole. There are certainly some very important research opportunities. So again, while we know a lot about the downstream consequences for health and well-being of an economic growth-oriented paradigm, there is less research that examines solutions. And that applies to well-being budgeting as well as any number of other elements of governance. So I think research on the implementation of different forms of governance, including budgeting, in their unique context, there's just many really excellent research opportunities there, as well as I would say work on how these issues are framed to make it easier for people to make connections. Thirdly, certainly this could be a viable focus for members of public health communities to mobilize around. So aligning with the Public Health Agency of Canada's identification of advocacy as a core competency for public health practitioners, but in a way that embeds the necessary critical thinking that I mentioned earlier. And then finally, as we bring forth what we value and perhaps what we have to offer to this discussion, a good dose of reflexivity and humility about our own positioning and our potential blind spots, I think will serve us very well when engaging in these conversations, which are necessarily interdisciplinary and intersectoral. So I will leave it there, and I look forward to the discussion.
Thank you very much, Chris and Lindsay. Both give us a lot to think about and bring some interesting, different perspectives for us to think about well-being, and particularly for our users, how it fits with public health. So we discussed a couple of questions that I would ask you following the presentations. And so we'll do that. Some of them, you've touched a little bit on within your presentation, so you can, limit. You don't have to repeat what the parts that you have. But the first one, Chris, that I want to ask you is, what are the challenges to integrating well-being budgets into policy? The main challenges. You probably can't tell us all of them.
Yeah, nor do I know all of them or can rank them all probably, but I suppose my answer here is partly informed by discussions I'm part of between the federal government and some provincial governments and local governments who are all thinking about how to do this. And it's certainly quite early days in some ways. I've written a recent white paper advocating for the idea that while there are some new institutions that we need to implement, most of them are evolutionary rather than, there are some institutions that need to be changed or built up, but most of them are evolutionary rather than outright new. So that said, one obvious thing is that the government trying to embrace this stuff has to make decisions about how to about a dashboard or some kind of framework for indicators. And that means converging on some kind of an accountable system. In my view, there's two fundamental ways to make something accountable in a way that it is constrained to be more than just this rhetoric I mentioned at the beginning. One would be a democratic accountability process where the government has gone and, like the UK government did a little bit, and through some process found out what everybody thinks is important. And the other is something that's empirically accountable. I strongly favor the latter because we're all experts on how good life feels. We're actually not necessarily experts on the counterfactual of what would make life better, because we haven't tried everything as individuals. So if you are able to embrace something like life satisfaction, again, with some measure of humility and openness to reconsidering it, but it looks like a very promising direction. And if you embrace that, then it is a guide to what are the other things you should measure. So in any case, for a government trying to do this, it's a process of transition. You've got some things which you've got some data that you have in hand. You typically try to build a dashboard out of data you already have or can easily measure without massive new expense. And one related challenge there is to do with data and measurement. So we want to measure what matters. We typically, as statistical agencies, are trying to measure what matters, but we can't tell what matters until it's measured. For instance, as people have gotten into the life satisfaction literature, we find, wow, every time we put something that has to do with any kind of social capital, trust, community, cohesiveness or social capital of any kind, it seems to be extremely important in explaining how people's lives feel. But we don't actually have a lot of measures of those things on hand. So there's a two-way process in which we learn something's important and then we need to add new measures in that domain. So that's not something easy to fix quickly. Nor does one want to change suddenly, because continuity in data are important. I'm going to throw out, I could probably go on too long and disillusion everybody by saying how many challenges there are, but I want to mention one more, which will show my ignorance and confusion and possibly create some more follow-up discussion, which is that from what I understand, there is a problem around the public health concept and agenda right now, in that, you know, one of the wonderful things about a lifestyle a well-being budgeting approach is that it gives different departments, different branches of government a common currency so that they can take into account of co-benefits of policies they are rolling out for other agencies and vice versa. And so it's great for synergistic policy. So on the other hand, there are existing turf boundaries, and so sometimes everything that seems to come under the whole broad approach seems to fit under some conceptions of public health, and I see that being still sometimes in some people's minds a confusion or a bit of a tension, because you know, obviously not all agencies fit under a public health agency, and so I think there's still some resolution exactly to what it means for under a well-being approach. How does public health fit, and what is exactly the umbrella concept and framework? I should mention one more quickly, but I'll just say, you know, the word there's a big challenge with interjurisdictional. Maybe this is partly Canadian. No, it's generic. At the interjurisdictional level, in that different levels of government also have synergies in none of them controls well-being, the supports of well-being individually, and they need to work together. That's always a challenge. It seems especially strong challenge if everybody at every level is trying to implement a new framework, that they don't, for instance, every municipality doesn't have to build their own well-being framework. So that's a challenge right now in Canada.
Okay, thank you, Chris. I was going to say, Lindsay, you want to come in on there a little bit before going on to the next question?
If that's all right,
Sure.
because this is about implementation. This question is about implementation. And so I just wanted to say, and I actually don't know the answer to this, but what comes to mind for me is looking at what we might already have in place as a cross-cutting mechanism in policy that could be mobilized for this purpose. And so one that comes to mind would be the federal government's gender-based analysis plus. So I actually don't know much about this, although I have taken the online course. And it just strikes me as maybe like an implementation mechanism that seems to exist. And I just wonder if there's space for discussion around a model such as that with respect to implementation of well-being budgeting. And again, I don't know the answer. It just struck me that there were maybe some synergies there.
Yeah, that's interesting, and one that is viewed, at least to some degree, as having been a successful way of disaggregating data by sex. I'll move on to the next question because it's a rather loaded one, a little long, where it's about 12 minutes to the hour. So I had said you could each take 5. I'm drastically cutting that down to just a regular, maybe 2-minute answer, but we do want to hear what both of you have to say. And so the question is, over the last several months, there have been calls for well-being to be a kind of driving force behind the recovery from the COVID-19 pandemic. So can you talk a little bit about what a well-being approach might promise for that recovery? And well, we'll start with Chris.
So I mean, one obvious thing to say, I guess, is that that it gives us a way to take into account multiple different impacts that the pandemic and policies are having on us at once. I think had the well-being advisors been in there after the epidemiologists and the traditional economists, we would have had more immediate attention to loneliness and to mental health and so on. But going even a bit deeper to I mean, and equal attention. I mean, these are things which should have been actionable and had enormous resources put towards them. But beyond that, I think, and it's partly in the scope of opportunities, I suppose, but the Wellbeing approach gives us a compelling and concrete way to think about the equity impacts of what's happened, and to think about the enormous transfers that that might be appropriate right now. And it gives us a way to think, to shift our focus. This is partly in the category of opportunity. It's an opportunity to shift how we think about mental health as well. So there are a lot of voices telling us that we're massively under emphasizing that. Actually, around the world, right, even in developing countries, it's an enormous opportunity and problem. And so having poisonous language like social distancing, which for some reason we're still using rather than physical distancing, and and equal investments and resources put towards countermeasures to deal with the mental health challenges, the relationship challenges, all this stuff that is inevitably going to come out. I mean, that's, I think, in another world, and so going forward, in another world in the past, but going forward, there's lots to be done there. Measurement opportunities as well. The United Kingdom has started tracking life satisfaction and a number of more affective measures of subjective well-being weekly. So Statistics Canada has not done that. It's moved a little bit towards, it's got some new ways of measuring things, new kinds of surveys, but it has not embraced that. UK, I suspect, is most likely going to continue that after the pandemic because it's become important. So, but in general, there's room for innovation in data measurement. And I could go on, but I do want to say something about the fact that one of the big lessons from well-being, science well-being, is that the process matters. So the way that how something is done can matter even more to well-being than what is actually done, than the traditional outcome. And so I think we need to think of all the opportunities for building community and giving people an active role in solutions right now around the pandemic. And that can also mean, yeah, well, I'll leave it there. That's vague, but we can think about what those opportunities would be.
Okay, thank you for that. Lindsay, would you like to answer that as well?
Sure. So I agree with a lot of what Chris is saying, and this is what makes me excited, is that there's lots of common ground here. So I would first of all say that when I think about pandemic recovery, I'm not thinking about getting through this moment, but more in the sense of a response that sets the stage for the future. And so I'm stating the obvious here, but the pandemic has made several things very, very clear. One being that health and its social determinants cannot be separated. And I use social determinants, by the way, as shorthand for social, economic, ecologic, colonial, et cetera, et cetera, et cetera. So that's one. And then another thing that's become clear is that when push comes to shove, so to speak, our governments can indeed mobilize and respond in ways that I think surprised many of us. And so here I'm thinking specifically about the federal government's income supports that were mobilized, incredibly when people's livelihoods were at stake. And just to be very clear, this involved overcoming some traditional jurisdictional boundaries around who's responsible for what. And they spent massive amounts of money erring on this, like explicitly erring on the side of generosity and relaxing eligibility requirements. So it's not, you could quibble about imperfections in the response, but I just thought it was incredible. So I fully agree with Chris that there's a very important window and opportunity for significant change to how we usually do things, including finding ways to break down silos that get in the way of substantive change. And so well-being budgeting is potentially very well suited to this because it's sort of inherently radical. It's shifting the whole paradigm by which we define societal success, and it's inherently cross-sectoral. So I think it offers, and so speaking to public health specifically, and I flashed a definition up on in my slides, I think that this would help us inch closer to that fulsome version of public health that I don't actually think we're doing right now.
Thanks. And that segs well into the last question that I will ask, and then we'll have a couple minutes if we have questions from participants. But you did touch on this in your presentation as well, but can you talk a little bit about how a well-being approach might be integrated into public health practice, kind of on the ground? What does it mean for that level of public health?
Mm-hmm. Right. So, I'm not a practitioner myself. I'm not a health professional. I'm an academic. So you can take this for what it's worth. But this is again related to why I threw up that definition of public health at the beginning, because I think it actually starts by remembering what public health is actually about, and then finding ways to walk the talk, not to put it too crudely. So public health is about primary prevention. It's about health promotion. It's about health equity. It's about thinking upstream about determinants of health and well-being. And you simply can't do those things without engaging politically and outside of the health sector. So I think it's very much about finding ways to do that, which again is consistent with the Public Health Agency of Canada's identification of advocacy as a core competency for public health practice. And so I want to be clear, I'm not saying that there aren't people in public health who do that. I think there absolutely are. But I personally don't feel like we organize very effectively as a collective. And I don't think we offer a coherent alternative for people outside of public health communities to get excited about and want to get behind. So I for one, I would identify as a public health person, and I want that. I want something like that to be part of, and I think this is an opportunity.
Okay, thank you. And thank you both again for both the presentations and for answering those questions. I see that we do have a few questions. Hélène's been monitoring them there. Hélène, do you want to ask one of the questions?
Yeah, there are many questions, but I think this one is interesting. Bruce wants to know if there are any examples of municipalities that have used well-being budgeting to improve population public health outcomes locally. And it sounds like it's a concept that would work better in local environments. Do you have anything? Yes, Chris?
I mean, well, I guess my short answer is no. There are municipalities that have taken various different kinds of initiatives towards it, including running their own new community level surveys around well-being. And there are municipalities like my own in Montreal who have people actively working on trying to build a well-being budgeting framework, but it's not at the stage where it's really affecting budget making.
Another one that got 2 votes. Yes, so sorry, Lindsay, go ahead.
That's okay, if that's okay. I think that's an excellent question, and I actually forgot to, I meant to sort of qualify that I've mostly been focusing on federal levels, and that's incomplete. Of course, we can think about different levels of government. I think municipal government is so interesting and promising because that's the level of government that's closest to the people. You know, municipalities are where we live and work and play and age and go to school and all of that. So I think there's sort of a natural fit there. And I do think that maybe there aren't, and I don't actually know, maybe there aren't well-being budgeting initiatives per se, but I think there's lots of things that are going on that are very consistent. So I'm just thinking of my own city of Calgary, and I'm actually not current on this. I think it's rapidly changing, but there has been a triple bottom line policy framework that's used to guide municipal decision-making. And so the basic idea is that policies are meant to be evaluated for their social, not just economic, but social, economic, and environmental implications as part of the development process. So to me, that would be very consistent with this thinking, even if it's not quite the same thing.
Thank you. Do we have time for another one, Val?
No, I think it's 1 minute to the hour, and I think something happens if we go on Zoom, we will all be kicked off. So unfortunately, I think this is a discussion that is going to be ongoing between people who are working on well-being, like Chris, and work from that perspective. And I hope at least there will be ongoing discussion with public health folks who are working from similar perspectives and looking for a way to keep this on the agenda and on the table for more discussion and hopefully some kind of integration. So I want to say thank you to my colleagues Hélène and Mylène for helping put this together and for being here, and especially to Dr. Lindsay McLaren and Dr. Christopher Barrington-Lee for generously sharing their time and their insights with us today, and say thank you to everyone who participated for being here, and we wish you a good rest of the day. Thanks, everyone.
Thank you very much.